I'm Dr. Lexi Wang, and I'm one of the facial plastic surgeons at West End Plastic Surgery in Washington, D.C. Today we're going to be talking about buccal fat, which is a very trendy topic. And first I wanted to begin with a little bit of anatomy. The buccal fat pad is located in all of us, and it's approximately, I have a mirror, approximately right here on me. This is the approximate location. It is connected to the temporal fat pad, and on a skeleton, where you can see it, is it tends to live right here-ish in this hollow, and then it is connected to the temple area right here. So you can see that there's a gliding plane where it tends to fall down from here into here. As we age, that fat will start to come down, and that starts to create that jowling and the fullness that you see around here, around the mouth. So what can you do about it? It's normal for us to have. It is made out of special fat, and its composition is a little bit different. So that's why it doesn't disappear when you work out or gain or lose a lot of weight. The only way to really manage it is to do something with it surgically. You can do this either through the mouth, so only internal incisions, or you can also access the buccal fat from the outside of the face, for example, when you're doing a facelift. The main thing to know about it is that you do want to be conservative, and it's very important to go to a surgeon who has your aesthetic and is not going to be super intense with this. The reason is that while it might make you look a little bit full when you're younger, as you do get older, you start to lose volume throughout all of your face. Eventually, if you have too much bone loss, you're trying to re-inject it with filler and fat to try to fill that back up. So suddenly you're now chasing the fat that you removed once upon a time. So the goal is you really only want to remove what's extra, so that way you don't end up looking too hollow or too old when you are much younger. Some risks also associated with buccal fat pad removal, other than the usual like scarring and things like that. It is located near to one of the facial nerves that moves the muscles of the face. It's also located near one of your spit glands. So some of these things can be impacted during the surgery. So again, you want to make sure you go to a specialist who can handle all these problems and appropriately identify them if that is an issue. When we do buccal fat pad removal at our practice is we don't remove the fat in its entirety. We just remove what's the excess, what comes easily, what's popping out at you, so that way you can still get a slightly more sculpted appearance, but you also don't look older than how you actually intend to look. So that's buccal fat.